Well, let's start. Hi, my name is Reed Lancaster. I'm one of 4 founders of DocNation. My partner, Justin Nabedy and Anthony Gufrida are joining us tonight to welcome and introduce Dr. Allison Cotton. Allison Cotton sent me her bio, and she's a very humble person. So it was like, I think she was struggling a little bit to get it over. And I was like, just send it over to me. I'll memorize it. And then I read it and I was like, I'm not going to memorize it because she's an exceptional human being. And she represents the best in the world. I can't think of a group of people who put more effort into serving other people than physicians, not one. And the military is neck and neck right there, but the most servant-hearted people in the world are physicians. And so I'm so grateful to know you, Dr. Allison Cotton. We're grateful for your time tonight. I'd like to jump in by reading her bio to everybody to give everyone a little understanding about her background. Dr. Allison Cotton is a double board certified child, adolescent, and adult psychiatrist practicing in Northern Nevada. Completed medical school and training at the University of Arkansas for medical sciences, immediately transitioning into a career in academic medicine. She served as clerkship and elective director, as well as associate psychiatry residency program director, before transitioning recently to a fully clinical position. In March 2020, she joined a group of 4 other psychiatrists to co-found the Physician Support Line, a grassroots national support hotline staffed entirely by volunteer psychiatrists and serving physicians, trainees, and medical students. Over the last 3 years, the Physician Support Line has taken over 3,500 calls, including practicing physicians and medical students who were actively suicidal during the call. She has had a series of excellent physician mentors who have helped her understand the importance of advocacy for oneself, and is happy to be here tonight to participate in a discussion of a topic physicians are too frequently afraid to talk about. That was wonderful. I had a big smile on my face when you added that last little piece, because you see Justin Nabedy on the screen. Him and I have been partners, and we've owned a business for over 15 years serving physicians. We've given our life to be the business specialists who serve physicians. And quite honestly, we've realized very, very clearly how doctors have never advocated for themselves very well. And so to hear you have a little insight to maybe some self-awareness and learning from some of your mentors was really cool. So come off mute, say hi to everyone, would you please?
Yes, thank you so much for having me. I'm really excited to be here to talk about this topic. I don't think we talk about it enough, and we're afraid to talk about it in certain spaces. So I feel like this is a safe space to speak freely. Yes,
it is. I'm so grateful you say that. And I want all the viewers to understand this is going to be a little bit of back and forth. We're really discussing and sharing stories of why we started DocNation. DocNation has been in the works for about 2 years now. And we didn't want to go public until we were fully ready to serve you. And we're really grateful that we did wait until we were ready because we have been inundated with calls and meetings and signups, and we're so grateful for you guys doing that. And so thank you so much for being a part of the nation. You mentioned something that is key and something that we've seen in the short time of being live as DocNation as a company. People are afraid to sign up for this webinar with their university addresses. That's sickening to me.
Or any employer address, really.
Yeah. Anything that ties them back to their life lord is what I've started to call their life lord. I played sports for a very, very long time. And we were respected at a different level than a physician is now. When you are the best in a room and you have studied more than anybody, you're the smartest, you're the best at that topic, for you to not be in control of your environment is sad. And DocNation was created to put an end to that. We're here to secure more money. I want to be very clear. More money. We're very good at doing it. Justin and I have been doing it for a very long time. We need to help you secure more money. We want to elevate you to gain your autonomy back. There should be no businessman, CEO telling you how to run your practice. And that's what's happening. 5% of C-suite individuals, so the people who run hospitals, 5% are made up of physicians. So better said, there is no representation at the top of a hospital or an institution. No correct representation. You have 95% of the people calling the shots that do not have the experience. I never played baseball for a coach that didn't play baseball. I'm not saying you can't. I'm just saying maybe it should be, the numbers should be flipped a little bit. So we have 6 bullet points that we want to hit on tonight. The first one is financial disparagement. The second one is autonomy theft, moral injury, golden handcuffs, and restrictive covenants. Allison, could you share a little bit about your story to help us gain a little understanding of your experience?
Yes. So the reason I'm here tonight is because as I was discussing a completely other separate topic with Reed recently, I happened to share my triumphant story, which starts with deep depression, helplessness, hopelessness, feeling like I did not want to be a doctor anymore. And I felt like it was my fault. I thought that it was my lack of boundaries as a new physician. I finished residency and fellowship in 2019. And so I was brand new, fresh out, working in academics. I accepted less pay. I accepted a 56-hour work week. I don't know why. Everybody else seemed to be doing it, and I just went along with it because I didn't know better. Nobody told me different. And I slowly was eroded. My own personal clinical practice was slowly eroded until I had none. I had none of my own patients. I was working 1.1 FTEs. I was not originally being paid for the extra 0.1. I finally, 3 months later, had a change in leadership in my department, and he secured an extra 0.1 for me. I had made requests for what I needed to be able to be the clerkship director and the associate residency program director and a good attending. I had made those requests, and it was a culture of no, and it was a culture of fear. And I feel my heart rate increasing right now, worrying that somebody is listening right now who might go back and say something to somebody that doesn't need to hear it. Although I will say last night I spoke very freely, not realizing that one particular person was present on this panel. I spoke very freely, and afterwards had to calm myself down because I'm still nervous about retaliation, and I don't work there anymore. So eventually, after a year and a half of hemming and hawing, thinking I can never be what I want to be, which is an educator, if I'm not employed by an academic institution, I finally said, I'm going to end up divorced. I'm going to end up in one of my own hospitals if I don't do something. So I made a change and transitioned in January of this year to a completely separate hospital, same region. But as I was negotiating this contract, I made sure to set appropriate boundaries. I made sure to ask for really 10% more than I felt I was worth, and they gave it to me. I made sure to clearly express during the process of negotiating the contract, I am not going to do these things. These are my boundaries, and if that's not okay, I can't work here. And I had never said anything like that before. I had never said this is a deal breaker and held to that firm line. I made sure I do not have a non-compete at this point in time. So I took all of the things that I learned from my previous employment and applied them to this job. And I feel like I have found the Disneyland of hospitals because it has been an absolute breath of fresh air working here. The amount of appreciation, the flexibility that they have offered me has been absolutely astounding. So it's night and day. So I feel like I'm sort of living the dream right now. And I'm happy to be here to talk about these things with my recent experience.
I think that's great, and thank you for coming on as a fellow physician and as a founder of DocNation. This group's been together for 2 years, and the DocNation concept I had 10 years ago. I mean, we've needed this for far too long, and it's coming to a head. I think COVID really pushed it over the edge where we got abused, and we did it willingly because we went into medicine for this reason. We have this conversation all the time on our DocNation meetings. People that go into medicine, and we touched on this, could do anything. We could be lawyers. We could be on Wall Street. We could do anything. We go into it because we want to be doctors. And that's probably why you stayed, to be honest. That was probably one of the last things that kept you together. And two things I want to touch on that DocNation, why we founded DocNation. One is we're going to negotiate the heck out of you. We have something called signature members. And you can go on DocNation.com right now, click on, get a free signature member review, and you'll meet one of us, and we'll go over that with you. But the other thing, why retaliation is so real is because we aren't a union. We aren't together. We don't have a players association. That can't happen if we have a union rep or a players association rep to stop that. And that's what joining as a member will do. Even if you don't need negotiation right now or financial advice, just joining as a member, DocNation will give us that cohort that we think it's 2,000 strong. We think if we get to that number, we can push around our weight fairly strong. To be honest, it's much less than that if it's one hospital. I know, Justin, we're talking to a group of 8 to 15 doctors in one hospital. That's enough to change the tide. And what we need to realize is retaliation is real, but also if we come together, we can stop it very quickly.
Yeah, I'm glad you said that. As business people, Justin and I have an extensive experience in the business world. And like Allison alluded to earlier, I was helping her with another matter because Justin and I have been serving physicians our whole career, and we do many different things. But Justin and I, we go into negotiations if it's business to business, maybe not even in the medical industry. And you start with either the lowest or the highest offer. And I thought immediately when you brought this to us, Anthony, I was thinking to myself, well, why don't you guys just all strike? Like stand up for an hour and say, no,
we're done.
We're not doing this anymore.
Yeah.
And we would mention that to doctors and people would be like, are you guys insane?
You guys have done a lot with this though, because we think as physicians that the news will be like doctors are the bad people. And, the regular people that I've talked to now can see it. And I think, health insurance companies have gotten over their skis. They're taking money from everyone, from us, from the patients. It's gotten to the point where everyone realizes the problems in healthcare is not the physician, right? They've tried to pin it on us. It is not our fault. And, but as physicians, we still think, we have a duty to serve, even if it was free. Listen, I get it all the time now when people know I'm a part of DocNation. There are emails we get back, and you guys see them, that say, what you're doing is wrong for building DocNation. And I think to myself, I'm like, how indoctrinated are these people? Like, I'm not saying stop taking care of people, stop being a good doctor. I'm just saying know your value.
Yeah.
Right? Know your worth. There's
I think we are repeatedly told that we're the caregivers. We're the ones with the big hearts. We're the ones that have the knowledge to provide the care. We are the altruists. We have sacrificed. We are so busy. We take call. We do 24-hour shifts, and we glorify that to the point where there's a sense of guilt when I'm not willing to work a 24-hour shift anymore. I'm old. I'm tired. I did my time in residency. I took my call. You're going to have to pay me now if you want me to work a 24-hour shift, just like if I worked at Starbucks.
Residents shouldn't do 24-hour shifts. I mean, it's just to the point where we've just accepted it. And, we do ache this back to athletes a lot. And people say, where did you get the idea from? I'm like, it wasn't that hard of an idea to get. I was watching a football game and saw how much the players are getting paid and I actually know some NFL athletes and how much their life is taken care of, right? They need a financial advisor, their agent finds one. They need a dog walker, their agent finds one. They need a new house, their agent helps them out with. I'm like, why don't physicians have that? Their notoriety in the field of not athletics, but education is the same. To me, it's the
Right.
Allison, can you talk about what happened? You were at a breaking point, and then you decided, I'm not going to let anybody push me across this line again. And you had some decisions that you made. What took place inside of you? Because I think everybody who's tuned in, they've got various things they're dealing with.
Yeah.
Can you pause there? I'm going to forget this if I don't bring it up now. As much as we've talked to Dr. Cotton about what we provide, she still says, okay, if I'm going to work that much, you're going to pay me. And Justin and I, as the business people with the company behind us, are saying, that's closer. You're getting closer, but that's not enough. I have a note down here. It's at the bottom of my list. Our job at DocNation is to end you guys trading time for money. You know, everyone looks at a doctor making 300, 400, 500, 700,000 is like, well, they got a bunch of money. No problem. Pause for a second. Physicians are getting 9% of the medical industry pie. That is criminal. That is criminal. Just like the NFL 10 years ago, that whatever the split is, it's now 50-50. It's now 50-50. You have professional athletes signing $380 million contracts. Why? Because as a business person, you say, okay, Steph Curry, his jersey sells for how much? And what happened? You had a group of agents, you had a group of attorneys come in and say, no. I'm going to take him elsewhere. I'm going to negotiate off on his behalf, and we're going to get him what he deserves. So number one, you guys are all grossly underpaid, no matter how much money you're making. And number two, you're likely all working too much. I'm not saying when you first start that maybe there isn't 3 to 5 years that you're going very, very, very hard. But after 10 years, Justin and my goal is for you guys to be able to say no more to medicine if you so choose through working through our passive income strategy. And I'm not going to talk a ton about that right now, but our goal is to get you more money and more autonomy.
Yeah.
Okay, now you can answer the question. I wanted to make sure, Allison, we get you more than 50% of the way there in your thinking. See, even her, you guys are just so indoctrinated. You work so hard. You give up so much of your life. You study for a decade, and you're so one-track minded that Justin and I said, okay, they need a drone. They need a drone, someone to look out for them.
I'm realizing that I was very much going to do this for free tonight. This is extremely important to me. I was going to do it for free. You guys just happened to offer me something in return for my time, but I'm thinking like I do things for free all the time without even realizing it. It's ingrained in us.
Yeah.
But Justin, to answer your question, I am really good at what I do.
Mhm.
And that it took me years to come to a point where I can sit in a forum with other people and say, I'm a badass.
Yeah.
I'm awesome. And I had documentation to show it. My evaluations from students, from residents, from faculty peers, all above average, far above average. I got emails and it's just reinforcement that what I was doing was good work. And I pushed for more money. And because they brought in a new grad at $40,000 more than what I was making as a third-year faculty member. And I didn't like that. So I pushed for more money. They said, no, can't do it. I said, okay, I want to moonlight. No, can't do it. I said, you got to give me something. It's in my contract that I'm allowed to moonlight. So you got to give me something. My boss came back to me after really pushing for moonlighting and said, well, I pushed for it. The answer is no. Also, you're being put on a performance improvement plan.
That's the retaliation.
That was on my birthday.
Happy birthday.
And it was a Friday, and I had taken the following week off.
Yeah.
And I sat there in the room with my boss, who was sort of being told that he had to tell me this. And I said, what do you think about this? And he said, it's shocking to me that this is what's happening. And I said, this feels like retaliation. He said, it looks like retaliation. And I said, okay. So that following week, that was the breaking point for me. I just thought I cannot, it is so demoralizing for me to have done what I did through the pandemic with the clerkship and the hours and hours and hours of work for free. The toll it took on my family, on my personal health. At this point, my blood pressure was running about 160 over 110 at baseline. Blood pressure is now completely back to normal. Checked it right before this. It's 117/55.
Nice.
Before, wow.
My job was killing me.
Yeah.
And I took that next week that I had time off, and I said, I'm just going to find a new job. And I cold called everybody in town and just was very warmly received. So it was, I had a lot of guilt about leaving students. I had a lot of guilt about leaving the residency. I was in leadership in these groups of people. And I mean, the students, the backlash from the students was hard to manage. It was really hard. Some of them were very angry, used words like abandonment, which no physician ever wants to hear. The residents were a little more understanding, but I still feel immense guilt. And there is still an underlying feeling that maybe it was just me. Maybe I just couldn't hack it. In spite of evidence to the contrary. So it's this kind of cycle of shame at like not being willing to just go along with everybody else, because I'm the only one who quit. Lots of people are still there who cried on the phone to me and called me and said, I need a psychiatrist, can you recommend somebody? I need a therapist, can you recommend somebody? Physicians way more experienced than I am, calling me saying, I can't sleep, I'm losing weight, my husband is going to leave me, we have to go to marriage counseling. They're still there. So there's a part of me that's like, what is wrong with me that I couldn't handle it or hack it somehow?
Are you saying that the pressure that's on them, that now that you're gone, they're essentially having to pick up the pieces because you're not there, and so you're feeling the burden a little bit of them feeling like they don't have you to support them?
No, this is while I was still there. This was months and months ago. The pressure they're feeling independently of me leaving,
I see,
is immense.
already
Was immense. And I do have, I'm extremely close with my direct colleagues in my department. They're amazing human beings who do excellent work, and I respect all of them. And I worried that I was going to lose those friendships.
I see.
And I that really weighed heavily on me. We're a very short-staffed department, and they are now picking up the slack.
We have a gross number of our clients telling us that they're telling their kids not to get into medicine. Matter of fact, we won't even support you. It's dangerous. It's dangerous to go down this path. It's weird from a non-physician, the reverence that physicians used to demand, 20, 25 years ago, it was just so different. And with the power of administration, the power of insurance companies taking over and really taking and just taking over you guys' ability to run your business how you want to, why would you as a parent want your kids to join? Why? What'd you say, 56 hours a week, Allison?
Yeah.
Well, that was what they said. I mean, I was easily pulling 80 hours a week, if not more.
I mean, and that's like, and it's funny, we say we work 50 hours a week and we don't even count the charting at home and the pre-work we do. I mean, it's not sustainable. And Reed, to echo your point, I mean, I call the 90s and the 80s the heyday of medicine. And what happened was the better people at business, and listen, I want to say this, I don't want you to say it because I want it to come from a physician. We aren't good at business, right? And people can get mad at me as another physician, but we really aren't. And there are other people out there that are very, very good at it. And they took a lot of advantage of what happened in medicine in the last 20 years. And just, I mean, there's some charts we've shown on some other webinars, just the fact that we got another pay cut this January by CMS, 4.5% across the board. That's the average. I mean, that's just straight up not many businesses can sustain a 4.5% pay cut. Walmart works at a 3.8% revenue. So if they got a 4.5% pay cut, they'd be bankrupt. So all physicians got a 4.5. That's not healthcare. Physicians got a 4.5% pay cut. Everyone else in medicine, everyone else, and when I say everyone else, I mean hospitals, NSCs, long-term healthcare facilities, the big players got a pay bump of about 7%. And why is that? The reason for that is they all have lobbyists, right? They all were able to lobby on the Hill and stop the pay cuts. And unfortunately, physicians don't. And that's where we have to come together. We have to have a voice. And this is where I'm going to say my last thing, and I'll let Reed go again. But we can't be that voice. I know we have a lot of physicians out there. I know some of you are on there that are arguing on the Hill, and you're doing a great job. You're keep going, but we need to put the experts to work. We need to hire the lawyers. We need to hire the businessmen to be on our side. And there's plenty of people out there that want to help us. The more we get out, there's plenty of people that want to help us. But we can't do it ourselves. The only thing we can do is we have to come together. We have to come together and put the people to work that want to.
Yep. So even, you know, we have those experts waiting and ready. And as Anthony told you guys earlier, this has been in process, actively building this business to be prepared to do what we need to do for a couple of years now. We've had people banging on our door to say, are you ready? Are you ready? Are you ready? We're seeing what's happened. And we are now ready. And so one of the ways you can join is there's two different levels of membership. Signature membership is the full shebang. We negotiate your contract, we create passive income, we do a whole bunch of things. And if you want to sign up for a meeting to discuss what that looks like, Justin and I will be taking those calls. And so when I say we've been spending time building this business, we had to really create a lot of time for him and I to be, and it's been more than we expected in the last 6 months, much more inquiries. And then there's a regular member where, what's it, Anthony, $500 a year to join. And
we basically mimic the AMA, and someone, great timing, Lily Love, the AMA is kind of useless on the questions. I kind of being nice. It's not useless overall as the AMA. It's just useless in lobbying for physicians. If anything, it separates physicians. It doesn't bring us together. They have their own agenda. But we're creating, and people don't like the word union. Call it whatever you want. Call it a nation. Call it a union. Call it a players association. But that's the general membership. And what that does is you'll get access to the videos, access to our quarterly newsletters. But what it does is give us some firepower to go get those people. And that you just go under membership and join DocNation on the website. And I think Lauren might be putting them up here. Yep. So that is just to join the nation and get through. If you do become a signature member, we do take any of that $500 and put it towards the signature membership fee too. So don't think you have to do both.
I think there's a request in the chat to go through the bullet points.
Let's do it.
Okay.
cool.
So we kind of talked about moral injury because your case is the definition of moral injury, I think. And I like, can you touch on the one thing though you told us last week when we spoke? The difference between the word burnout. Let's talk about the word burnout, because I love the way you spoke.
The word burnout puts the responsibility on me. I am burned out. I let myself get burned out because I didn't set appropriate boundaries, because I didn't negotiate properly. So why should I expect them to pay me more? Things like that. It puts the responsibility on us for how we're feeling. Moral injury is the term that we need to be using. Moral injury happens when we are repeatedly asked to do things that go against our moral or ethical codes or our value systems as humans or as physicians. So for me, for example, being asked to respond to emails for 6 hours on a Friday night rather than spend time with my husband, that goes against my value system. Being asked to treat children who are suicidal in a busy emergency room rather than admitting them to the hospital where they can have a room with their parents, with people that care about them, with a therapist who can come talk to them. That is moral injury. And that's what we're experiencing. It's not burnout. Burnout is when you've been working at Starbucks for too long and it's time for a career change. You're burned out on coffee. Time to go work for, I don't know, donut store. We don't want to not be physicians. I have rarely found a person who has said, I'm just tired of being a pediatrician. I just don't like being a pediatrician anymore. It's not that. It's that the system causes so much moral injury and so much demoralization from the standpoint of we are trying to do what we are doing and we are what we're meant to do, what we're trained to do. And we are met with so many barriers to that, so much paperwork, so much administrative stuff, student loan debt that cripples us so that when we do have time off, we can't afford to enjoy it. So that is sort of my topic that I talk about a lot is moral injury versus burnout.
Yeah, and I think someone says a great point here. We love what we do, just not the environment in which we do it. And I want to get to, and because this is what I like about DocNation, is we're going to take this head on. 2 people in a row talked about, no offense, but it sounds like joining DocNation, yet another scheme for more business people to make money off of stocks. Yeah, I when I came up with this, I basically said to everyone that I've partnered with on this and talked to that's not going to happen. Basically, our plan is that DocNation doesn't put $1 in their pocket unless for a signature member, unless they make $2. So at no point would any we be looking to take anything of what you have now at all. We're trying to elevate, all boats rise together. We're trying to get everyone up. Even if you just do join as a member, the $500 a year, if that is a little steep, you can actually talk to us, and we want to get people in to get that cohort. We just need some revenue to push lobby. I mean, they're not free, right? Push lobbyists, push lawyers in the right direction. But believe me, that couldn't be more of, I think the first talking point I had with Reed and Justin when we first met was that we are not going to do that. So that's one of our key principles. So I'm glad that came up though.
I see a question in the chat from Ryan Ismail, if I'm pronouncing that right. Why do we as physicians talk like we have to ask for something instead of talking about why we aren't, don't emphasize being in charge? Why don't we talk business, get MBAs and control the industry of medicine? I think I can tell you, I trained at the University of Arkansas for medical sciences. And yes, it's in the middle of Arkansas. It's a little podunk hillbilly state, but that training institution is a powerhouse of academic brilliance. I cannot speak more highly about that institution. There is a surgeon there who partnered with a local finance person and they have created this business of medicine track. You can start on day 1 of medical school and learn the business of medicine. And that was one of the things that I wanted to bring to my institution. And of course it was a no, because we don't have money or we don't have time or we don't have whatever. But I think we are talking more about being in charge. There are more people who are talking about the business of medicine. What is an RVU? I didn't know what an RVU was until I was well into being an attending. I have made sure personally that all of my interns that I've worked with know what an RVU is and know how that can be exploited, how you can be exploited in the RVU model. So I think we are becoming as individuals more likely to talk about these things, even just talking about money. One of my fellows who graduated last year was so hesitant to say the number that he had been offered. He was offered $320,000 a year to go work at a private inpatient psychiatric hospital in Virginia. And he didn't want to say it. And I was like, why? Why don't you want to say this number? Are you ashamed of it? Are you scared to share it? Because what if somebody has a reaction? Like, what is this thing we have about not talking about money? Because the only reason I knew that my friend was hired, my trainee was hired at $40,000 more, was because I trained her to talk about money. So I think the cycle is changing. We are changing as a group. And there are so many editorial publications and all blogs about moral injury. I should have had some handy. I don't have any links or anything handy right this second, but I can send them to Reed and the team, and maybe
And we can get those out
afterwards.
I think one of the bullet points we should touch on is restrictive covenant. I think this kind of, and one thing I was going to say when you were telling your story too, is that I know a lot of physicians out. I can't believe how many people are on here. It's amazing to see how many, and we did 1.5 week of marketing, had 600 people sign up, and there's over 200 people on here. That's amazing to see. But there are a lot of people in your situation. And they're coming out of the woodwork. We didn't know what was going to happen when we opened the doors to DocNation, and they were coming out of the woodwork. And a lot of people their restrictive covenants are so large and big that they have to uproot their whole life in order to get out of that situation. I mean, I know people that have 5-year restricted covenant for a whole county. I think that's one huge thing that DocNation is pushing for very quickly. And someone had a good question on here about I think it was very early on, about the restricted covenants that's possibly going through Congress. It was really funny. There was one, and I don't know who exactly it was, but there was one congressman who stood up and said, well, we can't have, everyone could have non-competes, but what about physicians? Because that would raise the cost of healthcare. Physicians could actually go next door and ask for more money, which just blew my mind. And there's even talks about having a carve out that doesn't cover physicians for the non-compete. And this is one stat that I always like to say when we talk about restricted covenants, is that 90% of doctors have a restricted covenant. Okay. They have this bill in Congress. You know why they have this bill in Congress? It's not for physicians. It's for regular people do you know what the average amount of the restrictive covenant in the general population is? What percentage would be? Reed, I think I've told you guys, right? It's like 20%. So 15 to 20% of people have a restricted covenant, and that's going to Congress because that's not fair. But 90% of physicians have a restricted covenant.
Who's speaking up for the doctors?
Weird.
Nobody. Yeah. No one's speaking up for the doctors right now.
So I live in northern Nevada, where we have I don't even know that we have fewer than 8 child psychiatrists per 100,000 children who need to see a child psychiatrist. We are in a medical desert. So for a child psychiatrist, or any physician in this area for that matter, to be restricted, when I'm saying I'm willing to go take call at the residential hospital in town on the weekends, and take some of the burden off of those 2 doctors who cover that call every other weekend. For me to not be allowed to do that, to share the burden of the health of child psych healthcare here in this region, I feel like that is different than Tesla saying, you can't come work for us, learn all of our super secret Elon Musky things, and then go work for someone else. It's different. We don't have secrets. Doctors don't have secrets. We have knowledge and a skill set.
The employers think they have secrets. That's the issue. They're stuck in their own world, thinking that what you are doing as if it's secretive. And to your point, it's not.
And it's all our IP, right? This is we kind of get full circle back to what Reed started with. We're the players. We're the players on the field. We're the Tony Romos. We're the Steph Currys. Without us, there's no game. I'm sorry. And I talk about this all the time, the know your value. Without us, there's nothing. You could not have a hospital and still have healthcare. You could not have medicine and still have healthcare. There was. If you joined a physician or a healer, whatever it was, all the way back to the beginning of time, there's no healthcare, right? And it just boggles my mind how we've been put in a box in the last 20 years, where the player is walked out into the arena and told to go dance, and then we just walk back in without asking why are we doing this? Why are we giving up our 20s to educate? Why are we paying insane amount of money now to get educated? And then when we come out, we have no autonomy. So I think we could go to autonomy.
Yeah.
We can go to autonomy theft right here. I mean, I'm pretty lucky in my situation to have a decent amount of autonomy, but at no point should a physician almost be told anything.
So I received a phone call last night from a trainee, a fellow who graduated last year, and I thought of you guys because he texted me and he said, "Can you talk? I just need you to tell me I'm not crazy." And I was like, "Oh boy, here we go." So he calls me. This is the same guy who was offered a ton of money to go work at this wonderful private hospital, and he said his CEO almost daily at this point is questioning, why is this kid still here? Why is this kid not discharged? Why is this kid still here? And he gave me an example of a child whose father had pleaded guilty. What was that?
Was it a physician CEO?
No, this is not a physician.
Exactly.
No, and that's he said, I wanna tell her she can go discharge him. Oh, wait, you can't because you're not a doctor. I mean, he was really upset because these are kids who are being sexually abused at home, or who have food scarcity and their parents can't get it together, whatever reason. He is a strong clinician. And yet he called me and he was like, I think I'm doing something wrong. He was made to question his own skill set because this CEO was not happy with how things were going, not happy with how quickly the kids were getting in and out of the hospital. Mind you, insurance is still paying for these kids. But what this CEO wants is the numbers that ping for her, the length of stay, the bounce back time frame. I mean, she was looking for very specific numbers, and he really was like, I think I might be doing something wrong. And it took me telling him, no, you're right, you're practicing good medicine, keep doing what you're doing.
Ask yourself this: in what other industry is the expert not in charge? What about this situation right here gives the CEO business person like me the right to be calling clinical shots? That's one of the main reasons DocNation was started. Money, autonomy, and freedom. Those are our three goals. I think we sum it up by saying secure, elevate, and command. Secure, more money. Elevate, meaning autonomy. If you are the one that spent 10, 12 years studying this particular topic, and this other person was studying business, why would they come tell him to leave, that kid to leave? It blows my mind.
Yeah. And you know, there are some good questions on here. It's funny. We always look to the bad and things, which I'm okay with answering. You know, how are we going to assure for transparency about how the money is used to advocate for doctors? Here's the plan, and you guys can tell me this is a bad plan. But the plan is we're going to have quarterly meetings with all the members. And listen, we're going to hopefully get big enough where that's going to be hard. But you know, this is a grassroots effort at first, and we need to just change the mindset at first. And that's what we're trying to do here. And just by the number of people that sign up for these webinars, I think the mindset is there that something needs to change. So our plan is to have quarterly meetings with all the members, town halls, where we decide on what we want to push for. And it'll, you know, not everyone's going to agree, but there will be a board at some point. We have a board now. It's just the founding members, but we'll have more people on board. There are plenty of physicians out there that want to advocate. There's plenty of physicians out there that have a lot of experience advocating. We want to give the power to those people. And then we want to give the power to the lobbyists that want to do it for us, you know, and someone said here very well that the AMA does have a lot of money going towards lobbyists, but if just look up what they're lobbying right now. I'm not going to go over it. I'm all for positive stuff. I don't want to talk about what they're lobbying for right now. It'll make you sick. But yeah, we're going to try to, our goal is to really keep it focused. The physician that you guys asked me, I think Justin, you asked me, what about dentists? I said, no, you need to have an NPI number, MD, DO. This is all we're doing. It's just a physician. We'll work with the nurses union. We'll work with the residents that just unionized, right? We'll work with all these people, but and the residents, well, I think we should work very closely with them, but we are going to focus on the physician elevating. And it's sad that we don't have to say elevate. It's more like reacclaim where we were, where we should be. So we'll see.
Anthony, can you speak to Srividia's question about the AMA and what the AMA has not been able to accomplish? Essentially, is kind of the point.
The AMA, listen, I don't want to bash the AMA. I really don't. The AMA is a pretty big group. We don't want to fight the AMA. If anything, we want to work with the AMA. They just, I think, can't agree amongst themselves. Therefore, everyone's pulling in different directions, and we can't actually push the spear in the direction it needs to go in. So that's where I'll leave that.
I want to create a little clarity on the business side of things. Then Allison, I'll let you go and we can end with that. There's two levels. The first level is a membership, $500 a year to be connected with us and get updates. We're going to take that money and we're going to do good on your behalf. And we can discuss transparency and stuff on that on the back end. But then we have signature membership. And that's when you come meet with us and you know exactly what we're doing because we're meeting with you. We're negotiating your contract. We're doing a whole bunch of things that you know every step of the way. what you're paying for. So I just want to be clear, there's two different memberships.
Yeah.
One is us meeting with you multiple times and setting out a plan for the rest of your career. So I just want to make that clear.
It's similar to the Players Association and your agent, right? It's really, one is a whole cohort of people, one's your personal concierge, day and night, whatever you need, kind of deal.
Go ahead, Allison.
So there was a question in the chat about where is this going other than a gripe session. And I want to speak to my specific reason for being here is because truly, and I actually get a little emotional when I'm talking about this. I quit my job, and last night I was in a med student forum on this panel about why being a psychiatrist is so amazing. And the person who wanted to put me on a performance improvement plan was present. That person is still in leadership at the place where I worked. You can all Google me. This is not hard information to find. And last night I was so anxious that I texted the medical student leader of the forum, who was my friend, and I was like, oh my God, was I too much? Was I too negative? And then I'm here tonight. I can't see the people who are here. I can't censor myself based on, is somebody here from my home institution? And people from that place were invited tonight. I know they were, because they said, what is this? Your name's on this. What the hell is this thing? And I was like, well, I'm going to tell you. Stay calm. But this is not just a gripe session. This is, I am trying to be a person who puts on the big girl panties and says, I will be courageous and speak out when I know that it would be very easy for this former employer of mine to say, you know what, you're out. You can't work with students anymore. We don't want you to teach for us. It's really scary. And we don't do it. We don't do it. So I am here doing it in spite of the fact that it's terrifying. So that's my why for being here, because I was fortunate that I found this hospital, which I don't know if I should say the name. I just won't say the name. Very close to a nice resort town in northern Nevada. And I am in shock daily about how they treat me. We talk about financial disparagement. This place has lost so much money on me in the last 2 months because they wanted me to have a nice transition to starting my job here. Today, 2 months in, was the first day of my outpatient clinic. And when I brought that up to them, because I was worried about it, I'm worried this is going to come back on me. They said, you know what? We're investing in you. You are a long-term investment. You are somebody that we want you to be happy. We want you to feel welcome. We want things to be nice for you. That's totally foreign to me. So I got so lucky happening into this job. And that has been really empowering. If I were still at my previous job, if I hadn't been able to find a replacement job, I would be too scared to speak even to my colleagues in the way that I'm speaking to this group of strangers that I can't see tonight. So I'm trying to model that it's okay for us to say things are not okay. That's extremely important to me. And that is what we have heard time and time again with the physician support line, is doctors calling us, hiding in the call room, in the stairwell, in the bathroom, in their car, saying, I can't talk to anybody at work about this because they'll think I'm crazy. They'll think I can't do my job, or they'll fire me.
Yep.
That's not okay.
Yep.
That's how doctors kill themselves. And we have to have that stop.
Yep.
So that's why I'm here.
Thank you.
And I applaud you and thank you for coming on. And, you know, we've had other webinars, you know, we've had an administrator on where we talked more business. And to me, this is maybe the most important webinar because this is our why.
Yep.
Right? Every company or every group of people needs to have a why. And we wouldn't be doing this if it was all, you know, gumdrops and rainbows, right? We want to make it better. I think everyone out there does. I haven't met a physician in the last year that says, you know, things are great. Things are great. I'm really happy in my position. I really haven't. I've met guys that said, oh, that's good. You know, I can tolerate it. And I think that just can't be the norm anymore. For the best, like the happiest people out there are like, yeah, I tolerate it. I get to practice medicine, in their system like that. And like we're lucky that we get to practice medicine in their system. That really irritates me. And there's more people out there, Allison, that that are in the same exact shoes as you. And I hope some of them are listening. And honestly, I hope we share your physician hotline with people too, just in case. So that in case anyone out there does need more help than DocNation can even provide. I mean, that's an amazing thing that you've said, and I applaud you for that as well. So thank you.
I'll put the number in the chat, and for the physician support line, there's no money. It's all volunteers. It's 500 psychiatrists who volunteer 1 hour at a time. And it's me, like it's me and 2 other people, actual humans, actual doctors who listen to the messages and get the calls answered and reach out when we need to.
Doctors fighting back for them on their own behalf has been a rare thing. So I really appreciate the comments questioning DocNation. And one thing I would encourage you to do, because we can't share specific details because we are working on behalf of a number of clients, a large number of clients right now. It's confidential. We're negotiating contracts, and we're people have taken steps forward with us in a significant manner. Sign up for a meeting. We would be happy to talk to you about what this is, a little bit more on the business side of things. So,
and even before you sign up to join the nation, if you don't want,
yes.
and we're not looking to make $500 off of you. Like I really hope that's not coming across like that. We're looking to make this a movement. And sign up for the meeting is free. And I think we've put the link up a few times. And after the meeting, if you want to sign up for the membership, you're welcome to. If you don't, you're more than welcome to. We need to move this in the right direction. We just know it's a problem. I've said this multiple times. We know it's a problem. We know there needs to be change, and we need to start standing up. And Allison's honestly, she's going to be a part of DocNation for a long time to come. So I'm excited for it.
We have 4, hold on one second. We have 4 doctor groups that we've been working with recently. 3 of them were producing above the 90th percentile in RVU volume, and they were getting paid just barely above the median. And that is abuse. You should know what your numbers are, know where you stack up with regard to the industry, and know what your value is so you can have an honest conversation with who you're working with. On top of that, we had a group of 4 surgeons who was getting paid $1,000 a day for some work that they were covering for an institution. And we got that bumped to $3,000 a day. We tripled it. So it's not about the $500. This is about giving you what you need to be effective, be successful with getting terms that are reasonable. It is so unreasonable right now for what they're doing to you. It's time to get you back in the driver's seat. That's what this is about.
Thanks for sharing that, Justin. I'm going to share something that just happened. It's really, really cool. This person is on the webinar right now. I'm going to keep it completely discreet. I'm not going to share any details, but we've had a few meetings, and this person just said, great Zoom call tonight. I am in for the signature membership. We discussed with this individual everything that we're going to do for them, not the $500 sign up, but everything that we're going to do for them to change their life. Moving forward, negotiating their contract, creating passive income, being that one-stop shop where we help do everything that you need. So Justin and I have even started a real estate company where we buy in, we help you sell your home and buy it. And so we've done everything that it takes to support physicians that we think our attorneys are ready to go to negotiate contracts. They're really good at it. And oftentimes after the negotiation, the hospital will ask our team, will you come negotiate on our behalf against the physicians? That's happened multiple times. And no, we can't, we're not going to play on both sides. So I implore you to give us a call, set up a meeting. Lauren will get you set up with Justin and I to discuss further what it looks like to become a member or a signature member. Allison, you've been through a lot in the last couple of years. You have made it to where you want to be. So grateful for your courage. We're here to back you up no matter what it takes. Sleep well tonight.
Thank you for having me. I'll be sleeping in a hotel tonight. In a blizzard.
Really?
Which is cool. My job is paying for it. So
Cool.
That's awesome. Very good. Well, thank you all. Thank you, Allison. And if we didn't get to your questions, you can email us at team@docnation.com. That's our email. One of us will get back to you. Usually within a week, we usually end up getting quite a few contacts and questions. Someone will get to you guys within the week, if not just one of us even. So sorry if we didn't get to everyone's questions. I know Justin's been answering a lot of them as we've been talking as well, or we answered a few of them live. But thank you all for joining, because this is what it's all about, is coming together as physicians and hopefully moving this in the right direction, and we'll see where this goes.
That's right. Thanks, Anthony.
I'm gonna stick around. I'm gonna stick around for a little longer to answer some more of these chats, because once we hang up, it'll end this, and so I want to stick around for a little longer.
Are you going to verbally answer them, or are you going to just be?
You can type them in, or we can go through a few more if we want. I mean, we like to keep it to an hour because people start dropping off, but we still have quite a few people on here.
Yeah. So, question about signing up for signature membership.
Yeah.
Let's get a meeting to go through the specifics of your situation to make sure it's a good fit.
I
So,
can
like
answer
Anthony
that
said,
one I'll answer that one with the contact us page.
Yep. It varies, and they're saying, oh, well, why does it vary? Well, it varies because how much money are you making? How much money can we negotiate above and beyond? And so it varies for everybody, but it is. Go ahead.
That's part of the we don't want to hurt you kind of
Right.
deal. We want to make sure that it's the right services for where you're at, what you need, what you can do. You know, and that's all concierge kind of deal. A la carte concierge. We get it working. Is this being recorded? Yeah, it'll be recorded. It'll be on our YouTube, and then the YouTube will link to our DocNation page, DocNation.com. Pretty easy.
Yep.
Awesome. There's so many in here. If anyone's asking direct questions about their situation, I suggest getting the free signature service review. Honestly, we do a lot of stuff for free. We'll go through your problem. It won't just be one meeting, even sometimes. So we'll go through your problem and try to help you out.
Yeah. Most of the time it's multiple meetings, 3, 4, 5 meetings. And that's okay. That's okay. We're here to help. Allison, I just want to step in here for a second. If you're leaving your place right now and going in a blizzard to a hotel, feel free to go do that.
it's like across the street.
Okay.
I'm not worried about it. It's
Like, I don't wanna
the
tell you
surgery
yet.
is supposed to let up in about
Okay.
30 minutes. So
All right, cool.
so there's a question about having live sessions. I'm assuming that question has to do with like everybody's on and we're having some like back and forth rather than a one-on-one session, because clearly we've been talking about one-on-one sessions already.
Plan for that is around July for our first one. We want to get everything up and running for the people we're negotiating for now. Also, just how the sessions work with everything in the different states and in DC. We don't think we're going to get anything really done that quickly this year. So the plan is for July to have our first town hall with all the people that actually join the nation, become a member or are a signature member. Everyone will be invited to that. So probably July time, but keep a lookout. It could be a little sooner if we have a lot of people, kind of an influx all at once. We want to get everyone's ideas. I mean, it's just as useful for us as it is for the members. So we want to know what people want.
Yep.
Last one here is asking about private practice getting lowballed 50% less than the median. Like, holy cow, that is insane.
I mean, we could
That's
have
insane.
a whole webinar on the MGMA data and how that's really manipulated and how that is used to keep physicians at that 50%.
There's a couple of notes that I didn't get to, but the MGMA data is not slanted in your benefit. Just FYI. Just FYI.
And we go online and then we use it against ourselves when we're negotiating. We go, hey, this is the 50. They want us.
It's rigged.
Someone.
It's all rigged.
The last webinar, someone had a great point. They said a lot of hospitals are afraid to pay anyone above the 90 percentile because they get dinged for I don't know what, right? But and even the hospital administrator we had on last time talked about that, how hospitals are afraid to pay anyone above the 90th percentile. And someone made a great point. If no one ever makes above the 90th percentile, the bell curve will never move. You'll keep everyone in that median range of 25 to 75%, and the bell curve will never move. So I don't think they're afraid to pay anyone over 90th percentile. They just don't want the bell curve to move. Because if the 90th percentile becomes the 50th percentile, everyone, frame shifts up a little bit. So yeah, that gets tough when you start negotiating yourself with that kind of data. It's tough to see.
So back to that question though, for Bob, and I think this is the name. So it's going to be a question of a partnership track or no partnership track, and how do you deal with that situation? So let's talk offline about it.
Yeah, that's
in terms of a buy-in versus no buy-in, or a combination of performance and whatever. There's a number of factors that go into that. There's, even if it is like great on all other aspects, there might be a way that you could address being lowballed in, like, on the back end, but the numbers have to make sense, and the profitability has to make sense, and the ownership structure has to make sense. We've got a group talking to us where the founder is offering a sliver, like a tiny piece of ownership, and it is so backwards, so upside down, and they're a huge group and they need a lot of help, and so we're going to bat for them.
So I think this is good. Who determines the salary for superstar athletes, and who said we are underpaid? I mean, that's just the market, right?
It's about revenue. What are you generating?
The market.
How much revenue are you bringing in?
Determines the salary for superstar athletes. I mean, you pay if you.
What's the question? Whoa, I was an athlete. I got paid to play baseball.
The salary for superstar athletes, and you say we are underpaid. So who determines our salary then? And please don't say MGMA baloney. I guess we already said that. Sorry. But our salary is very much determined off MGMA. I'm sorry if you don't want to hear that, but you can talk to your hospital administrator about that. It's very much, they're actually held to scrutiny against their data. So if you work in a hospital system, and who determines the salary for superstar athletes? I mean, it's the Players Association has a collective bargaining agreement with the owners. So there's a collective bargaining agreement, how much money the players are going to get, and every single professional athlete right now, professional system right now has a 50-50 split. So there's X amount of revenue that's made, and then there's 50%. There's some, I mean, we don't need to go all into this, but there's some that have salary caps and some that don't. Right. And then that basically is what determines what they make. But it's the market that determines what they make, and based on no salary cap, you could see what happened the last 2 years.
But before there was a players union, they were not getting that split. And that's
that's why you see all these 60s and 70s football players announcing still.
That's right.
They didn't have to. And one thing I think we touched on is people are looking to leave medicine to do other things. I mean, Allison, we talked about this, and it's not because we're burnt out, it's because of the abuse. But no one, if you're at the pinnacle of your profession, you shouldn't be looking to do other things, right? There's no athlete out there looking to say, hey, maybe I should become an eye banker, right? There's no athlete. I mean, there are some, you hear about it, and it's always national news. Like, this guy was in the NFL for a year and then he became a lawyer, right? It's so far and few between because they're not looking for it, because they have such a great life and everything's taken care of for them. And that's how it should be as a physician. It should be so competitive to become a physician, because it should be the most glorious job out there, because we are doing thousands of years of human history. The healer was the person in charge. That's right. And it's only changed in the last 30 years.
That's right.
I think it's also important to point out that it's not just the revenue. It's not just my RVUs, my patient up billing that I'm bringing to this hospital. When patients, whatever you are, primary care, endocrinology, when a doctor is happy and can practice medicine, their patients love them. Our patients love us. They do. And even surgeons, patients love you. I know they do. They may not say it, but they do.
They do.
I love to harp on surgeons, but there are intangibles as well. So I mean, 4 patients that I saw in my clinic today don't have primary care. What did I do today? I referred them to primary care within this system, because it benefits me to be able to communicate with their primary care doctor directly through the medical record. So that's 4 patient referrals for more revenue that indirectly is coming from me. Also, when a hospital has a bunch of great happy doctors running around, smiling and practicing medicine like the champions that we are, people notice, the community notices. The hospital gets stars behind its name. It gets mentioned in the news. Like, it is a big deal to have good doctors. So there are so many intangibles that we bring to the table that we forget about.
100%.
If you're looking, go ahead.
I just said know your value. I mean, that's so much of that is
Yeah, I mean, I have a couple of notes that I wasn't able to get to, but know your value. And I have a question underneath. I mean, how do you know your value? You know, people are always saying, know your worth, know your worth. And I think they're inherently saying, just know how special you are. No. Come to DocNation and let us tell you what your actual value is. And then let us go to bat to get that value for you. And then I want to reverse to one other thought that I had about a question earlier. Do a little research. It doesn't take a lot. Do a little research on what the NFL was like before the Players Union. That's what DocNation is trying to be.
Yeah. There's someone here asking about, we want 50% like athletes. We don't want 50%. If we move that 9% to 11% of the pie, all physicians would make about 2 times as much. It's a big pie. It's a really big pie. And yeah, we're not going to get 50%. We're not asking for 50% at all.
More than 8% of that pie would be nice.
We're solidly at like 9.91 last time the data came out in like 2000. I think it was 2020. The data 2021. The data came out.
Yeah.
Hey guys.
Thank you, Allison.
I'm gonna
Appreciate you being here.
Yes, I think we should end it there. Allison, thank you so much. Appreciate your courage.
Thank you guys. And thank you everyone for joining, honestly, and thank you for the questions. We really appreciate it.
Have a good night. Thanks.